Okay, Dr. Gibb, I am rolling now, so I'm required, if you don't mind, for me, you've already done this, but if you could give me your full name and title, please.
Sure. So last name is Gibb, G-I-B-B. First name is Randall, R-A-N-D-A-L-L. And my title is Chief Medical Officer of the clinic at Billings Clinic.
All right. Now, I understand we just got word that, along with, of course, it wasn't too long ago that Community Medical Center here in Missoula joined the Billings Clinic family. I understand you've expanded that family eastward into North Dakota, right?
So, yeah, just one point of just clarity is today is the first step. Really what we did today is we signed a letter of intent to explore the possibility of Trinity Health and its health system coming into the Billings Clinic Regional Care Joint Venture fold. So,
okay. Now, when you say it's a first step, what does that first step entail, Dr. Gibb?
Yeah. So what this basically did is over the last 6 months, our joint venture and the Trinity Health System have engaged in preliminary discussions looking at the culture and the mission and the vision of each organization, and seeing if that would be a good fit for us to look at having them join our joint venture health system. And so that was that 6-month process. And over that time, there were other people, obviously, who they were interested in looking at. And we received word from them that we've been chosen as the joint venture group to move forward with further discussions.
Well, that must be very encouraging to you folks, then.
Yes, it is. We established a joint venture about 2 years ago. We were very pleased and still are ecstatic about the opportunity that we have with Community Medical Center in Missoula. And we now see another potential great opportunity to look at another system in North Dakota, which is the Trinity Health System, for very similar purposes.
Now, what would be the advantage to both organizations for you to join forces?
Yeah, this is a great question. Facing healthcare right now is a term which is becoming more and more apparent, which is called population health. And what we're really asked to do as physicians and as healthcare entities is to develop collaborative teamworks and partnerships across health systems. And the reason for that is we understand that as you reach a certain level, you are able to provide for the patient population in such a way that there's advantages across a regional landscape. So the reality is by adding a very similar, like-minded hospital as Community Medical Center and Billings Clinic and Regional Care have already done, we would be hopeful that we could extrapolate those efficiencies and those practices and those clinically integrated networks and practice patterns to benefit the patients of North Dakota.
Now, have there been any talk of financial matters as of yet, or is it still in the preliminary stage?
No, the financial discussions have been very, very preliminary. They're spelled out in raw numbers, but the reality is what that's going to take shape as these discussions move forward and as due diligence becomes more mature. We'll know that in about 90 days.
All right. So what's the next step? Where do we go from here?
Yeah, so the next step is what's going to happen is very similar to what happened at Community Medical Center. Over the next 30 to 60 days, we're going to be sharing information between the two systems, looking at ways in which we do and provide our healthcare business. We're going to be talking, obviously, with a number of the healthcare providers in the Minot region. We're going to learn from them how do they view the care they give the patients in Western Dakota, what are their needs, what are their desires, and then look at opportunities that we can develop stronger relationships in doing that. And then ultimately we want to come to some agreement that lays a foundation for them formally joining the joint venture.